Hi, I'm Dr. Donna Gurley, and we're going to talk today about the 10 essential services of public health. This presentation was originally developed by CDC, and I've modified it for my presentation for you today. So you'll see a lot of the same content, but you may see it on the internet as slightly different. Let's get started. The things that we want to cover today are describing the roles or essential services of public health, review the history and development of why these 10 things, why not 10 different ones, how they came about, and really explain how they're used as a framework for public health functions and initiatives. First, a little history. The core public health functions were outlined in the 1988 Institute of Medicine report, The Future of Public Health. The IOM report stated that the three core functions of public health are, as you will recall, assessment, policy development, and insurance. This is a good start to describing public health, but in 1994, when the country was exploring issues related to healthcare reform, the public health sector felt that a better definition and description of public health was needed. Hence, these functions were developed. Public Health in America has a statement that provides a vision and mission for public health, as well as the content of what public health should be prepared to do and how public health service is delivered. The vision for public health is broad: healthy people and healthy communities. The mission identified is to promote physical and mental health, and I would also suggest spiritual health, and prevent disease, injury, and disability. The last part of the Public Health in America statement defines the essential services of public health. The 10 essential services are shown here on the screen, or at least the first 5, and include monitoring health status to identify and solve community health problems, diagnose and investigate health problems and health hazards in the community, inform, educate, and empower people about health issues, mobilize community partnerships to identify and solve health problems, develop policies and plans that support individual and community health efforts, enforce laws and regulations that protect health and ensure safety, link people to needed personal health services that assure the provision of health care when otherwise unavailable, assure the competent public and personal health care workforce, evaluate effectiveness, accessibility, and quality of population and personal health care, and research for new innovative solutions to health problems. The Public Health Wheel shows the 3 core functions: assessment, policy development, and assurance, in black around the external or outside of the wheel, of essential services. In principle, the 10 essential services can be grouped under these 3 core functions. Essential services 1 and 2 fit under the core function of assessment. Essential services 3, 4, and 5 fit under policy development, while essential services 6, 7, 8, and 9 fit under assurance. Research, which is the essential service number 10, and system management form the center or hub of the wheel, since these activities are included within all 3 core functions. These 10 essential services provide a framework for defining public health activities, describing public health at all levels, developing national performance standards, and providing accreditation structure for health departments. Essential service number 1 answers these questions. What's going on in our state or community? Do we know how healthy we are? Use of appropriate methods and technologies, such as geographic information systems, can be used to interpret and communicate data to diverse audiences. And collaboration amongst health departments can actually benefit people by providing private providers and health benefits to a variety of groups of people, and manage disease or immunization registries. Essential service number 2 answers these questions. Are we ready to respond to health problems or threats? How quickly do we find out about these problems? How effective is our response? This includes epidemiologic investigations of disease outbreaks, patterns of infections, chronic diseases, injuries, environmental hazards, and other public health threats and emergencies. Active disease, infectious disease epidemiology programs, and access to public health laboratories capable of conducting rapid screening and high-volume testing. These support essential service number 2. Essential service number 3 answers this question: how well do we keep all segments of our state or community informed about health issues? These types of services would be health information, health education, and promotion activities designed to reduce health risks and promote improved health. Health communication plans and activities such as media advocacy and social marketing. Accessible health information and educational resources. Health education and health promotion program partnerships with schools, faith-based communities, work sites, personal care providers, and others to implement and reinforce health promotion programs and messages. Essential Service 4 answers this question: how well do we truly engage people in state community health issues? We can do these through identifying potential stakeholders who contribute to or benefit from public health, building coalitions, partnerships, and strategic alliances to draw upon a full range of potential human and material resources to improve community health, and convening and facilitating partnerships and strategic alliances among a diverse group of people, because they're all needed in undertaking improvement to health, prevention, screening, rehabilitation, and support programs. Essential Service 5 answers these questions. What policies in both the government and private sector promote health in our state and community? How well are we setting health policies? Some examples would be effective local public health governance, development of policy, codes, regulation, legislation to protect the health of the public, and systematic local public health departments and state-level planning for health improvements for all jurisdictions, and aligning those local public health resources and strategies with community health improvement plans. Essential Service 6 answers this question: when we enforce health regulations, are we technically competent, fair, and effective? Some examples of these would be assurance of due process and recognition of individuals' civil rights, enforcing laws and regulations and public health emergency action plans under a broad board of public health or another regulatory body, review, evaluation, and revisions of policies designed to protect health and safety, but also reflect current scientific knowledge, educating people and entities obligated to obey and agencies obligated to enforce laws and regulations to encourage compliance. Enforcement activities in a wide variety of areas of public health concern under authority granted by a specific law or rulemaking process. These are all areas that can answer that question: when we enforce health regulations, are we technically competent, fair, and effective? Environmental Service. Essential Service 7 answers this question: are people in my state or community receiving the health services they need? Some examples of this would be assuring the identification of populations with barriers to personal health care services, assuring identification of personal health care service needs of populations with limited access to a coordinated system of clinical care. And also assuring the linkage of people to appropriate healthcare services through the coordination of provider services and development of interventions that address barriers to care, such as transportation, cultural competency, linguistic competency, and staff that have or have access to these materials and knowledge. Essential Service 8 answers these questions. Do we have a competent public health staff? How can we be sure that our staff stays current? The answers to these questions lie in education, training, and assessment of public health staff. Are they meeting community needs for public and personal healthcare services? Identifying efficient processes for licensure of professionals, and typically each state licenses its own group of healthcare professionals or public health professionals even. The adoption of continuous quality improvement and lifelong learning programs that include determinants of health. Active partnerships and strategic alliances with professional training programs. And continuing education in both management and leadership, and developing those for an administrative or an executive role. That's also known as succession planning. Essential Service 9 answers these questions. Are we meeting the needs of the population we serve? Are we doing the right things? And are we doing the things right? And this can be determined through assurance of ongoing evaluation, critical review of health program effectiveness based on service utilization data, assurance of the provision of information necessary for allocating resources and reshaping programs. And finally, Essential Service 10 answers this question. Are we discovering and using new ways to get the job done? Public health research activities include initiating research, participating in research by others, reporting results, and implementing policy based on these results. Here are some additional sources of information on public health services and standards. This is Dr. Gourlay saying thank you for watching.